different parts of the world, trying to come terms with all the time differences and all, but you still had the time to spare for this webinar. So thank you very much. And on behalf of all the members of the Equitable Access Healthcare Consortium, we thank you. So quick introductions, which I want to do, sparing about 30 seconds each. So Dr. Pramesh is Professor of Thoracic Surgery, Director of Tata Memorial Hospital in Mumbai. Thank you very much for joining. Professor Parag Singhal is a consultant endocrinologist in the southwest region of England. He's an executive director of Bapio Training Academy, CQC Specialist Advisor, National Secretary, British Association of Physicians of Indian Origin. Dr. Ravi Kohli is a psychiatrist, medical director at SPHS USA, president-elect of American Association of Physicians of Indian Origin. Dr. Raj Gopal Reddy, Director of Operations, Chandan Hospital in Lucknow, and Ankit Modi, who is a computer scientist and AI researcher from IIT Kanpur and a founding member of the healthcare and health tech startup called Cure.ai. And I am Dr. Venkat. I am a consultant radiologist, and I'm the director of Excel Hospital in Hyderabad, and also the CEO of this organization called EHAC. If anybody wants to know more about EHAC, we'll send you a link in the chat room, and you can just visit our website regarding what we do. So, okay, let's start with this very important topic, often under-recognized in various healthcare systems. And I just want to step back a bit and quote a couple of journal articles which I came across. So, Indian Journal of Critical Care Medicine in 2020 August said the prevalence of personal burnout was 44% in healthcare workers. And the younger respondents, which were 20 to 30 years of age, had a personal burnout rates higher than the other population. Prevalence of burnout was significantly higher in females, and doctors were 1.6 times higher at risk, and support staff were 5 times higher at risk for pandemic-related burnout. And then before the onset of pandemic, BMJ 2019 said burnout is an occupational phenomenon, and we need to look beyond the individual to find solutions for it. So with this background, I first want to ask Dr. Ravi Kohli, being the expert in this field of medicine, psychiatrist. I just want to just dig deep and try to find a definition. Where do we actually call burnout as burnout? Because many people tend to not recognize it and almost in a state of denial, and they carry on till it's probably too late. So can you tell us and highlight what's the definition or what we actually call it as a burnout? Over to Dr. Ravi.
Good evening. Thank you for having me here, and I won't belabor the introductions. And also you alluded to all the facts. There's a higher incidence of burnout in female physicians, and also the suicide rate is 2 times the normal population rate in America for females, and 1.5 times the suicide rate for the normal general population for men in America. So 200 to 300 up to 400 physicians commit suicide in America every year, which is like losing 2 classes of graduating medical students, costing almost $1 billion loss of manpower. Having said that, we all have been kind of pounded on in our head with what is burnout, what is the definition of it. So I don't want to go too far into it. I think we, like anything else, you know it when you feel it, but it's sometimes hard to define it or because of the denial. So basically, it's an emotional exhaustion, cynicism, as well as loss of purpose in what we do. Those are the Maslow burnout index questionnaires. And it's pretty straightforward. There is a Copenhagen questionnaire also that much more simpler way of identifying burnout. That's a quick and rapid response to your question. Thank you.
Thank you. Thank you. We'll come back to that more in detail. I just want to move on to Dr. Raj Gopal, who is actually my friend and my colleague from ISB days. And he used to tell all of us that he actually suffered this condition himself. So I thought it was very useful to bring him on. Thank you, Raj Gopal, for being with us today. And I just want to go through your experience because you suffered yourself. And if you could just enlighten us what exactly happened and maybe some potential solutions for it. Hello? Can you hear me, Raj Gopal? I think his connection just got lost. It's okay. We will just move on to Dr. Parag Singhal. Dr. Parag, thank you once again. From Bishkek, you're joining us. So, hope the city is very beautiful and lovely time of the year, I believe, this time. So, just coming to this topic, you've been a very experienced senior clinician in the NHS, and you probably came across many junior doctors, nurses, and colleagues also, many senior colleagues also, who probably faced burnout and came to you for help, came to Bapio as the organization as to help, especially from the Indian subcontinent. In your experience, can you let us know what exactly were the situations, if you can describe, so that we can all learn from the experience? Thank you.
Thank thank you, Venkat. Pleasure being here. So, yeah, I will just take a step back and I will probably call it what we are witnessing now. And I won't go into the data because it has been already highlighted by Dr. Ravi. What we are seeing is a generational change. So, 30, 40 years ago, people would do a job for financial stability, and that would drive them to continue doing that job. Now, what we are seeing is a younger generation which is not interested in financial stability. They have that stability. They want to enjoy the job, they want to enjoy the life. And so they are looking for two things. One is they would enjoy the job if it is highly skilled, whether it is some surgical technique or something. But in a routine, mundane job, what is happening is now what the system has overloaded them is a so called framework for the governance, paperwork, and everything. And one of the juniors working in cardiology setting in a tertiary hospital was saying that her 20% of job is just seeing the patients. 80% of the job is booking the patients for angiogram. She says, this is not my job. This could have been done by somebody else. And it leads to frustration. And it doesn't matter what you do, you start highlighting, but nobody actually takes any interest. Now, let me come to senior doctors now. Now, there is enough data to suggest, and Royal College of Physicians conducted a survey, 2016, 75% of consultants reported that they feel devalued. When they are saying they feel devalued, they means that nobody in the organization is actually willing to listen to them, value them as an employee of the organization. And what I'm trying to highlight that the senior doctors and the junior doctors are witnessing micro irritations, micro aggressions on a daily basis. And all these micro irritations on a daily basis lead to frustration, emotional burnout, and you start doubting yourself. That is the problem with me, that nobody is actually listening to the problem I'm highlighting for betterment of patient care. So when you start doubting yourself, you obviously then get into the spiral. Now, there is, of course, a generational gap of resilience. Probably people 40 years ago were more resilient. And nowadays, a younger generation, as I said, they have a different purpose in life. That is my take right now, what is happening as far as the burnout is concerned.
Thank you. Thank you very much. We'll come back to your thoughts in a bit, but I just want to move on to Dr. Raj Gopal again. Raj Gopal, are you back? We were just asking you the question. I think I can see him.
Sorry, yeah,
On
I
the,
think we had a blackout here.
okay.
So I can't join back on the video because I'm on my phone Wi-Fi.
Okay.
Anyway, so
We can hear
sorry.
you clearly. So it's about your story, about what
Yeah, so
exactly happened in your
sorry
case.
we lost each other. Actually, I am a cleft and craniofacial surgeon, and for 20 years I was part of a team that was, I think, the most prolific surgical team in this field in the world. We were doing 1,500 surgeries every year, and 1,500 to 2,000 surgeries every year. That was cleft surgeries, and about 20 craniofacial surgeries a year. And for a long time, I took pride in saying that I never took a holiday. I worked 6 days a week. I was rushing, doing everything. We built our own hospital. But then again, like Dr. Ravi said, you start those three things of the Maslach burnout inventory. you start, you start losing touch with the real world. You start losing touch with your patients. You start losing touch with, you start becoming, you depersonalize yourself. But I didn't realize that. And it became worse and worse and worse. And then I was thinking, why am I not feeling the enthusiasm to go to work every day? I was coming to work, doing everything. I was like on automation. So then I realized that something is not right. It's not right to, come to work and not be happy coming to work. If you're not happy coming to work, it means there's something wrong. So I was, and as a doctor, you tend not to take advice. You think you know everything. And I started, feeling the need to move away, or step back, or give up everything that was medically related. And I did that. I moved out. I stopped operating. I stopped going to the hospital. I moved to a completely new city, because I knew if I was in the city where my hospital was, I would go back again. And then that, I think, is, again, as a doctor, you start analyzing yourself, and then you never take any advice. And that's what I did. And I should have taken advice, and I would have probably gotten to know what was wrong with me much earlier than I actually did. But then anyway, I took a year off. I was on almost a year sabbatical, and then I realized that you know I can contribute again to the medical industry, to the medical fraternity, but not as a surgeon, because I just felt that I didn't want to go back into the thing of working every day for 8 hours, 10 hours, and then working 5, 6 days a week, not taking holidays. I didn't think that was very good for my health. And then I decided to come into management, and then went and studied management again after that, and then moved on. But then it comes to a point where that's my feeling for us doctors and as medical professionals is, there are two ways of looking at it. One is you individually try to find out what's wrong and try to change it, but that doesn't work. And if you go to take advice from somebody, I think it takes too long for you to get back into the system. And I think that's what most people face. And I think they're afraid of that. They think that, okay, if I leave the system and then I take help outside, I may not be ever able to come back into the system. So, both of them have their pros and cons. And I feel that that is what we need to discuss a lot more on, what are the signs to look for when to seek help. And if you're seeking help, what are the realistic goals, or what are the realistic, what do you expect? And when do you expect to get back into the system? And I feel a lot of people, like you said, in the US, it happens in India too. Once you leave the system, it's very difficult to get back into the system again. So
Thank you. Thank you, Raj Gopal, for really opening up what you went through. I'm sure people who are listening to us, and also this being recorded, many people can resonate with what you said. We'll just move on quickly, because I realize that there is already 15 minutes gone. So, Dr. Pramesh, you are obviously a very senior clinician working in one of the most renowned hospital in the country, if not the world. And I'm sure, being a very busy place, a major cancer center with referrals from all over the country and abroad, you have your workforce under immense pressure, no matter pandemic or not. And there is so much of patient related pressure as well, to perform, to deliver, to make the patients better. Are there any organizational policies within Tata Memorial which really looks into the well-being of the workforce? Because we always talk about patient-centered healthcare, right? But we never talk about doctors' well-being, although it's just being heard in some of the organizations. Uh, are there any policies, or are there any interventions that you can think about, or if you're doing any such things in your own organization? Can you enlighten us, and we can maybe take an example and provide that solutions to different organizations?
Thank you, Venkat, and thank you to the EHAC for organizing such an important webinar on an extremely important topic. So I think the very fact that we've accepted that burnout is an issue amongst healthcare providers is a very important first step. And whether we like it or not, it's the reality, and you could sweep it under the carpet, but I'm much happier acknowledging that this exists and trying to deal with it. And however cliched this might sound, uh, this is one area where prevention is probably better than cure. Very often we equate organizational responses to, are we providing adequate counseling for people who have burnout? Are we providing support for those who have burnout? But to me, I think we need to step back a bit and see how we can avoid burnout or reduce burnout in the first place. And whatever you might do to help individuals who go through this process, just as Dr. Raj Gopal said, it's creating an enabling environment. And like many other organizations, we initially had taken the first step that we'd provide a counseling cell where we would have anonymity for people who consult the counseling cell, and that we thought would be the end to all of these problems. But I don't think we could be farther from the truth. While I would not devalue the importance of these supportive assistance mechanisms like having a counseling cell, having psychologists and psychiatrists helping out with that, a much bigger effort needs to be made to ensuring that people don't get burnout in the first place. And towards this, we've taken several steps. And if you ask anyone who's gone through burnout, it's not that burnout is directly related to the amount of work we do. It is to some extent related, but it's not the only thing. There are several other contributing factors to this. And to me, it comes down to having two fundamental aspects. First, the question of how are you meeting the aspirations of your workforce in what they expect. So very often we are so caught up with the importance of patient care that we miss out on this important part of what it is. And what is it that makes your the workforce in your hospital happy? I'm probably oversimplifying the whole thing. And to me, it comes down to two parts of it. One, is the work challenging enough? So if you have a young, enthusiastic person, whatever field that individual might be in healthcare, could be a nurse, it could be a physician, it could be a paramedic, it could be even a ward boy or a ayabai in the hospital. Are you ensuring that you're providing enough challenge to them that they feel fulfilled in what they do? That's the first question. The second is, do we value the work that they do? A lot of the burnout is because people put in their full efforts. It may not meet your expectations as an administrator or as a leader, but if they are putting in their full effort and not getting valued or appreciated for it, it leads to this sense of what am I doing this for? And what's my purpose in working in this environment? And that really causes a lot of angst amongst individuals. I think one of the earlier panelists spoke about this being generational, and I agree. Earlier, we were just asked to suck it up and accept it, and we swept it under the very convenient term of resilience and strength. But I think it's a different world now, and the earlier and the sooner we come to accept this and try and find solutions to this, the better off we are. To me, I've learned a lot from the people who undergone burnout and have shared their stories with me, primarily because it gives you a completely different approach. Very similar to what Dr. Raj Gopal mentioned. I used to go to work at insane hours, 4:30, 5 in the morning, getting 2 to 3 hours of solid research work before the clinical work started, getting back home at 9 o'clock at night. And you can do it for some time, so long as it's challenging and so long as it's working well for you. But beyond a point, it gets to the situation where you start thinking, why am I doing this? And I think the important key and the key lesson to learn from all of these experiences, mine included, is to make sure that we course correct much before we end up in a situation where we regret the choices that we made. And however cliched this might sound, I think the emphasis needs to be to reduce the environmental factors, and by environmental factors I mean the work atmosphere, to making it more conducive to people enjoying their work rather than reach a stage where they get burnt out. I keep saying this to a lot of my colleagues, friends, mentees, that you probably need to put as much thought into who you work for as who you marry. because you probably spend more time at the workplace than at home. And if you don't ensure that you're working in a place which values you, appreciates you for what you do, gives you challenges to keep you going in life, uh, we probably make compromises which ultimately end up in a situation where things like anxiety, depression, burnout, all of these come into the picture. So I'll stop with this, and happy to follow up on this subsequently.
If I may add, Venkat, a lot of us think success leads to happiness, but I think it's the other way around. If you're happy, you'll be more successful. I think our educational effort should be not learning based, but not outcome based, but learning based. If you're learning something from the education we are doing, rather than productively being more productive, that's not going to be really educational. Just butt in. Thank you. I think you're muted, Venkat.
Completely agree with what you said, Dr. Ravi, and we'll come back to Dr. Pramesh's point because I have a couple of questions on that. But before that, we'll just touch base with Ankit. And me and Ankit work very closely on AI because we are both interested in the field of radiology and diagnostics. But an interesting thought I had when I was speaking to Ankit recently on some other topic, and I sometimes wonder, is the technology that is coming into healthcare since the last 10 years, 15 years, forget about AI, but even basic things like healthcare records, mobile phone, digital treatments, are these actually adding to the stress for the healthcare providers, or are they helping out? Because we are probably in a transition phase, right? I myself have moved from paperwork to digital, and I've seen the digital transformation throughout my career of 20 years because I was perhaps the last to hold the film in my hand before switching on to digital x-rays, for example. But with this new technology coming in almost on a day-to-day basis, is this really interfering in our work? Or do you think eventually this is a passing phase, but eventually they'll help us to reduce our stress and make our lives easier and concentrate on patient care? What do you think, Ankit?
Yeah, thanks, Dr. Venkat. So before answering question, I want to touch on one more point. So basically, I think I can safely count myself in the generation that Dr. Pramesh and Dr. Parag were talking about. So, so from my perspective, what I feel is that, uh, because there is you have already seen some sort of abundance, just providing for the family is not enough, that is already done. So now when you are in that position where things are okay and running fine, how do you find meaning in life, right? You have to have something that keeps you going and keeps you driving forward, right? And that is where I think people of my generation are going sort of above and beyond in their work and trying to find meaning in work. And that is one problem that I guess all of us need to be aware of, that there is probably more to life than just work. Uh, so yeah, having said that, coming back to your questions, technology, right? So like any other thing, I feel technology is a tool, right? And this tool can be used to either, do positive things, or it can affect you negatively. So if I look at the AI technologies that we are trying to build, we are looking at, ultimately the goal is to be able to make doctors spend more time with patients and take away the mundane tasks that are on their plates right now. So when we say that, so for example, when we say that we are good at reporting normal x-rays, right, we can take that away from your patient list. What this means is that if you are looking at 30 x-rays a day and 15 of them are normal, then you are only required to look at the rest of the 15. And that also means that you can actually take a deeper look at them and not be bothered about the rest of the 50% cases. So that's a good use case. Whereas, if I can give you example of where technology is a bad thing and is actually adding more to what doctors are supposed to do. So we recently launched an application where, you had to fill in symptoms of the patient before taking their scans, right? And what we realized was, the
radiographer over there is already noting down these details on a paper and then asking them to just again redo it on the mobile application is probably not a good idea. I mean, it's adding more to their work. So what then, I mean, the way we solved it was like, I mean, it's already noted down. Why can't we allow them to take a picture and upload on the app? So that way the technology then solves that issue for them. So it's really about how you use technology. And the third thing that I want to add is, I think, I mean, the esteemed doctors on this panel have been in healthcare for so long that it might be, I mean, a bit difficult to plug out and see things from a different perspective, right? So for me, like, I mean, I am coming from an engineering background and I could have never imagined in college that I would be working in healthcare. But today, I mean, I find myself very lucky that I actually have an opportunity to, even from a distance, I have actually an opportunity to help people when they are at their most vulnerable, you know. And that is something that, I mean, sort of keeps us driving towards giving more and more to our work. But then again, I mean, it comes at a cost and we have to be very conscious about it and know how to tackle it well.
Yeah. Thank you, Ankit. I'll come back to you regarding the situation of startups because that's been the focus since the last couple of years. So I'll come back to you and I have a couple of questions on that. But let's go to Dr. Parag Singhal and Dr. Ravi because I believe they are wanting to finish the meeting a little early. But Dr. Parag, I just wanted to ask a question regarding performance and its relation to burnout. So we as doctors, especially in an institution like NHS, we are always expected to be right on the top, right? Providing the best healthcare in the world. We have to be the best doctors in the world. We have to be the best listeners in the world. We have to always be on the patient's side, no matter, even if it is silly. We have to dedicate some time, even if there's another patient in an urgency mode. So with these high expectations for any big organization, NHS or institution like Tata Memorial or the US healthcare system, many institutions in India have got similar kinds of standards compared to the NHS. So with this high expectations from our organizations, is it adding to the burnout? How do you balance these two things? Because there is one side, the expectations that you're always wanting to be the best, and the other side, preventing you to balance it out and, consider your own health and safety issues as well.
Thank you. So first of all, let me just take a step back again. Doctors, engineers, and all these people, highly trained people, are actually very intelligent and clever people. And as Dr. Pramesh said, they need intellectually, they want to be challenged intellectually, or the environment has to be intellectually stimulating. Now, one of the problems we are encountering right now is that it is not only the managers of the organization which is setting high standards, but doctors themselves set very high standards for themselves. And as a result of that, because of the environmental factors, because of the systemic issues, those expectations or standards of care are not delivered. So inevitably, there is bound to be mismatch between what you're expecting and what you're delivering. And some people can take it better than others. It leads to that. But more importantly, within the NHS, what we are witnessing now is that doesn't matter how senior you are as a consultant, doesn't matter whether you lead or not, you are not in control of anything. You cannot bring about a change, even a small change, to make things better, despite the fact that you're witnessing this day in, day out, your team is witnessing it, but because of the system is such, and this is an enormous challenge NHS is facing. The doctors, who are clever people who want to bring about change for the betterment, are not in control. And unless until we give them that control, we empower them to set the standards, to achieve those standards, things are not going to get better. Therefore, there is urgent need for some structural reforms within the NHS. So that is the fundamental problem we are dealing. And it is not about counseling. Counseling is late. Counseling is already the person is down the line. It's all about actually, and Dr. Pramesh also highlighted that point, valuing people. You don't value people by saying thank you. Thank you is okay. But thank you has become part of lip service. Oh, thank you very much. But the real thank you is when somebody is listened to, those suggestions are acted upon, and control is given back to people who are leading the service. And sadly, that is not happening.
And within the organization like British Association of Physicians of Indian origin, many people who go from India or Sri Lanka, Bangladesh, Pakistan, etc., you deal with so many people. Do you think that there is an element of more stress in this particular cohort where they are suddenly expected to perform at the same level in spite of passing the exams? The expectations compared to their British counterparts is slightly higher than the others. So, anything that the organization is doing to help this out? Because I know that you and Dr. Ramesh have been at the forefront of fighting for equality and rights.
Thank you. I think that's a very important point. And I think although things are getting better, but it's still a huge challenge where the overseas doctors are not considered at par with local doctors, whether it is access to study leave, access to study budget, getting or giving them, providing the same opportunities. And when that happens in day-to-day life, we call it a very useful term, microaggression. So the overseas doctors face aggression, not in terms of racial abuse anymore. It's a microaggression. They're ignored. And everybody gets that feeling. So that is there. And it is something which we as an organization try to be realistic. But at an organizational level, we have created a document dignity at work. And we are trying to implement those dignity standards at work, which actually include treating every member with dignity. And dignity does involve that you are listening to your staff and valuing your staff, irrespective of ethnicity. So we are trying, but it is going to take long time. It is not going to happen overnight.
Thank you. Thank you so much. It's a pleasure to listen to you. But we hope that you can hang on for a few more minutes till the end of the session for some Q&A. But if you're in a hurry to catch a flight or
I,
something, please go ahead.
I will see how much I longer can
Thank
hang
you.
on.
Thank you. So the next question is to Dr. Ravi Kohli about mental health issues. This pandemic has, witnessed some horrific incidents, and we as frontline healthcare providers have seen deaths in and out. Not only in our patients but also in many cases some of our relatives as well. So it had a huge impact on mental health for the healthcare workers. And now, although we are at the fag end of the pandemic, and we hope that there are no more waves to come in the near future, but how can people actually come out of that phase where they witnessed trauma? It's almost like somebody going to a war and coming back with post-traumatic stress disorder. But do people actually care? Do organizations have any coping mechanisms to help the doctors instead of just asking them or expecting them to work as a routine? Can somebody actually reach out to them and find out, because not many people will come out themselves. Sometimes there has to be a reaching out phenomenon. Do you think there could be any such mechanisms to improve the workforce? Because all over the world we are witnessing mass resignations. Doctors are leaving, nurses are leaving, healthcare providers are leaving heaped and bound. So we don't know how the next 10 years is going to be. Any thoughts on that, Dr. Ravi?
Very good question. Dr. Parag mentioned about microaggressions, and the word he coined also, I like it, micro irritation, but I will call it micro annoyances. Those are all parcel of our profession and professional hazard that we face. And there are factors, both internal and external. We come into this profession being a perfectionistic or success-oriented, achievement-oriented, that is adaptive to some extent, but anything taken to extremes can become maladaptive. And that's where it becomes. And sometimes, unfortunately, these maladaptive behaviors are rewarded by the system, so that keeps being reinforced. So we need to decouple those things. What is adaptive versus maladaptive? First, we need to identify among ourselves as well as systematically. So we value each provider, each person that is in the system. And so I think the thought process is there because more and more medical professionals are taking lead in the management as well, not just the bean counters up in the C-suite. So we do gaining control of this situation, but ultimately it comes to the individual himself, acceptance, and also we talked about a little bit about immigrant population, right? We have a diaspora, And we have a tendency to avoid and have a stigma to acknowledge our own emotional problems. We kind of somatize them. That is a cultural thing. We need to kind of make a cultural shift. This is okay to have a psychiatric or emotional problem. You're not a weak person having suffering from that. So we need to acknowledge ourselves and leave those stigma, shame, and personal humiliations we feel, or we feel like we're putting our family's name into dishonor and all those things. So we need to educate the person, the culture, the media, the legislators. For example, somebody said about licensing problems that you may face. Re-entry into the profession is a problem. Dr. Raj Gopal said it. So these are all the factors. There's no one solution that's going to solve all these problems. It's a systematic problem. And going beyond the systematic problem about the institution, it's a societal problem. There's an equity issues related to everything, including access to education, access to transportation, access to healthy environment, access to good food, access to everything. So equity is so important. That's what we are all here about, equity, right? So we are facing the problems and challenges at the downstream. And jumping into the river to rescue somebody is very heroic and gets into the 7 o'clock news bite and all that. But the prevention part, the more upstream part doesn't get the same glamour. Just like primary care doesn't get rewarded, just like the specialty care does. So unless we value preventive care, primary care, put them on par and give them more empowerment, we're going to continue to repeat the same mistakes over and over. So there are so many things that we can work on, but it's a discussion for a long whole day session, I believe.
I believe you do take well-being sessions, or at least prevention on burnout sessions. So we are hoping that you'll probably take 1 or 2 hour sessions for all the doctors in our organization, and if not
Absolutely.
more. So
that's one of my focus as the president of API, taking over on June 25th. Physician wellness and addressing the mental health stigmas in the general society are my two primary focus for my mission for the year ahead.
So we'll be privileged if you can do one more session specifically concentrating on this topic for all the doctors.
Absolutely. Absolutely.
Thank you. So just moving on, I'll ask a question to Raj Gopal. Raj Gopal, you are based in Lucknow and operate a very busy hospital. And I just want to know your thoughts on the setting that you work, because our organization, EHAC, not only looks at the urban healthcare, but also rural and remote areas as well. And as we all know, as we all read in the newspapers, violence against doctors is increasing day by day. And I'm sure, being in an institution which is based in Lucknow and a very big institution, you probably have come across many such incidents. And the extreme example has been just news from yesterday from, I'm sure Dr. Ravi knows, Oklahoma. Patient actually went and killed a doctor because he was not happy with his treatment. So that is quite extreme incident. We are just seeing a shift of trend from patients treating us as doctors to quite the opposite. Right? And this is definitely adding to the stress, the burnout experience that we as doctors have. And this is not confined to just the urban setting. It is everywhere. Every country, every location is feeling this stress. Any thoughts on that regarding how we can actually prevent this kind of incidents which is happening day in, day out?
I think, see, a lot of times what happens is we have a knee-jerk reaction. We wait, like Dr. Pramesh was saying, we need to, stop it from happening rather than waiting for it to happen and then reacting to it. And so, what steps can we take? Because this is going to increase because, the pandemic has made people more, I don't know, I mean, they've lost the ability to understand things. Everybody's become desperate, the doctors and the patients. It works from the society upwards. So the patients' expectations from doctors have increased because of modern medicine. The way it has moved, people expect miracles. They don't happen, and when they don't happen, people get violent. And in especially from where I come, where my hospital is, probably we have a lot more violence than the rest of the country. But what we do in the hospital is we have made some systematic changes within the organization, where we've asked the doctors to be very sure of explaining everything to the patient beforehand. So even if it's an emergency situation, we have trained our doctors at least to explain to the patient what the worst case scenarios could be too. I think if you explain to the patient what the worst case scenario could be, then the patient expects that that could be one of the outcomes. You've got to explain to the patient that we are not gods, we're not superhuman people. We are people who can who have a job to do. We're technicians like anybody else. So we have a limit to what we can do, and we're basing our treatment on experience. Most of our treatment is on experience, so we try to inculcate that. Our emergency services are geared up to that, to explain to the patients what can and can't be done. We're very clear about what can't be done. We try to explain to the patient. I know it creates a lot of people think that if we say that this can't be done, or these are the downside of the treatment that we're giving, or this can happen, these are the problems that you could face, they leave and go to another hospital. So be it. But then if you do it continuously, then the patients trust you. They say that, okay, this doctor is explaining to me what might not happen also. So then they start. It takes a long time. It took us 4 years to get this moving. We had no patients in the beginning because we were telling them both sides, the good and the bad, and we never could build a clientele good enough. But then slowly things started changing. Now we find that the aggression, the attrition, that's come down quite a bit, because the patients don't, we don't raise the expectations. A lot of times I feel when we practice, we give too much hope to the patient. Most of the times we say, okay, this has no, I'll get this done. This will be okay with you. But what happens with us is we have tried to, train our doctors, and, we keep constantly telling them that try to use, your statistics. Say that, yes, this is in 95%. I mean, publications say in 95% of the patients it gets no problem, but in 5% of the patient there could be a problem, and then list out the problems. I think if you do that, your patients also start expecting that there could be problems, and then when the problem does arise, they are not aggressive. They are ready to discuss the problem because you've already initiated it. And medicine, like any other, I mean, like if you make a product, they're going to be products which are not going to pass the scrutiny. So medicine itself is a very unsure topic, and I think the more we talk about that, the less stress is on the doctor. Finally, the stress on the doctor or the nurse or even the housekeeping staff is huge already before you start anything. And then if you're trying to get the patient which is uninformed into this, the stress is going to increase. The more you inform the patient, yes, you might lose the patient to another hospital. That's okay, but at least the patient is informed.
Venkat, if you don't mind, can I butt in a couple of things before I
Please.
I think it's important to give them not false hope, but false promises also we should not give. We should give them hope, but not false promise. That's one thing. And you also mentioned about post-traumatic stress. Yes, so stress causes post-traumatic stress disorder, and some people return back to baseline. But there's also another outcome, post-trauma growth, that also can be possible, because I want to stress the positives here today. Post-trauma growth is characterized by 5 dimensions. One, improved relationship, increased gratitude for what is good in life, and awareness of your own strengths, and embracing new opportunities, and all those things. We can accomplish those things by paying attention to the moments of grace and abundance in our life. We take them for granted. We take what is right for granted, because as a physician, as a human being, we are programmed to see the problems. That's how our brain works. Otherwise, we won't survive, right? So we are kind of keenly looking for problems, trying to solve them, and everything else we take for granted. So we need to put that aside. Having that gratitude, journaling, and all those things are good practices. So I just want to give the positive way of thinking at the problem. And optimism is also important. Emotional intelligence is so important, because again, communicating with the patient, your success doesn't lead in your technical skill, your emotional intelligence. 80% of your success is dependent on your emotional intelligence, not your technical success. Thank you.
Very, very interesting. Definitely want another session from you, Dr. Ravi. So I wanted to confirm straight away. But thank you for that. And very interesting term, post-traumatic growth. So we just want to know more about it. Very positive. Thank you. Just quick questions to Dr. Pramesh and Ankit before we move on to audience questions. Dr. Pramesh, in your institution, which is considered one of the best, most reputed patient care centric organization, as well as for trainees, because I just want to go to the grassroots level where I want to touch upon the trainee environment in institutions, because we are all trained not to say no to any of our consultants' requests or orders or whatever we may call it. In an institution like yours, which is very busy, so people tend to work very hard, but tend to hide their stress or their emotional variations, if I may call. How do the consultants go about treating this in a positive way, so that at the same time the trainees learn from all the consultants, but also they try to be very open, say no to a few things, or say that I'm not confident to treat this patient because it's beyond my scope, but also create a learning environment where they feel comfortable. Can you just enlighten us on those aspects, please?
Thank you. Thank you for bringing this up, because if you hadn't, I would have brought this up myself, because this is one of the most important areas where um, typically the medical profession is extremely hierarchical. Uh, it's even more hierarchical in India, but even across the world, it's hierarchical, where this consultant, resident, trainee relationship is a very strange relationship where they are expected to respect them because of their hierarchy. They are expected to follow them because of what they do. It has its pros and cons. It's kind of a guru-shishya relationship that you have, where you learn on the job. It's very different from the other areas. But at the same time, what we also need to understand, and this is one of the fundamental areas. So we did this study amongst our own residents. I think it was pre-COVID. It was 3 or 4 years back, about what was the rate of burnout, what was the rate of depression, and the statistics were not happy. A lot of them had weren't feeling well about their job, weren't feeling valued in their job, didn't feel that their efforts were being appreciated. And that's when we took a course correction. 4 years back, we brought in the system of having a mentor for every single student. And while this might seem theoretical and probably not useful from a practical sense of view, it really helped. In addition to having a teacher, I mean, every student in India has a teacher who signs off on their thesis, their dissertation, and so on. But in addition to this, we had a mentor who was distinct from the teacher. And to a lot of us, this actually helped. And I think one of the biggest changes that we've been able to make is stop reacting to situations with a response like, we did it 10 years back and we lived and to tell the tale and we've been stronger for it and we've learned so much from it. Converting that kind of a narrative to, I understand what you're going through. We do understand that you need to learn as well as go through a happy experience during your residency and your training, and completely change the conversation into something as enabling rather than enforcing. And we've consciously tried to imbibe this amongst our faculty. Now, this kind of a change is not going to happen overnight. We've been ingrained into thinking that we worked so hard, so why can't these people work so hard? Which brings me back to this very convenient term called resilience. We were resilient, we were strong, we were tough, and that's how and especially in the surgical field where I am in, this is considered a virtue rather than a vice. And if you're considered to work long hours, punish yourself to a point of feeling terrible about it, but still glorified for the kind of efforts that you're putting in, we completely change that narrative into saying that we understand what you're going through and we'll help you go through it. And to us, that's been a very big shift in the way we've turned around things. I'll take this opportunity to touch upon a couple of things which some of the earlier speakers spoke about. Ankit spoke about tech enabling physicians rather than being a hurdle to them. A lot of tech does that, but a lot of tech does the reverse as well. So if you want to ask So I've spoken to a lot of physicians who use electronic medical records. Let's use electronic medical records as an example of what I'm trying to illustrate here. The single biggest pain point for a physician is using an electronic medical record. In the US, 80% of the time that is spent between a physician and a patient is the physician staring at a computer and trying to make sure that the records are entered right, whether it be using a dictaphone, whether it be directly entering into the EMR. In India, the average time that a physician spends with a patient is about 3 to 4 minutes. Imagine 80% of that time going into staring into a computer. What have we brought this patient-physician relationship into? This very sacred relationship, which is important, which drives all of us, has come down to technology overtaking the compassion about this. And this is where I think we need to ensure that the tech that we use to enable the patient-physician relationship actually does that and not the reverse. My final point is about recognition and prevention. And I think a lot of the others agreed when I said that we need to prevent this rather than try to solve the problem after it has happened. And one of the key elements of doing this is to ensure that we identify the high-risk areas. We know that there are areas. So I work in an area which is lung cancer. 85% of patients with lung cancer come to me at a stage where there is virtually no chance of cure. So my experience as a physician cannot be the same as someone who's treating common colds and coughs, because 99% of those physicians end up with a happy outcome, whereas 85% of patients whom I treat end up with an unhappy outcome. So the kind of interventions that you need to do, the kind of preventive measures that you need to do to ensure that people like physicians treating cancer, physicians treating palliative care, end-stage renal disease, end-stage diabetes, all of them are identified as high risk, and preventive measures being taken and interventions being put into place so that they don't enter a phase of burnout and depression, rather than try and treat them after they've entered this. So I'll stop there.
Thank you. Thank you. Very interesting thoughts, Dr. Pramesh. We've got about 10 minutes, so I have got two questions, one for Ankit and one for Dr. Shweta, who kindly volunteered right at the last minute to answer a couple of questions on burnout in women. So that'll be interesting to hear from her. But before that, Ankit, I just wanted to quickly touch upon you regarding the situations in the current state where the health tech startups have been in focus. Since the last 3 years or so, there has been tremendous interest, investor pouring in money, but at the same time, on the other side, there's a lot of pressure as well to perform. I know there are about 500 AI companies similar to yours all over the world, so you have to compete with them. Every day, startup culture is that there's no break, there's no Sundays, there's no nights, because you have to speak to your US counterparts, etc. And this certainly is risking burnout big time in startups, and eventually, they fail out. And one of the reasons is burnout for the founders and co-founders. So can you highlight this in your own experience, because yours is a big startup and yours is worldwide. So what are the things that you can experience, and also any preventative measures that you can think of?
No, sure. See, startup is a fancy word these days for setting up a business, right? I don't think any startup is doing more work than what Dr. Reddy has done to set up his hospital, or what Dr. Pramesh is doing in leading his institution, right? So it's just a fancy word for doing work. And I think all doctors here work on all Saturdays and Sundays, and they don't look at times when they're working on. What has actually worked for us being a startup and being an organization which has a lot of young people is that two things. One, we have empowered our employees to say whatever they are feeling about. So we have a group where people post why they are taking off and for how many days they are taking off. And we have seen messages like many women have posted about taking a day off today for menstrual pain, and that is a line that would be taboo at a lot of organizations. You would not put it in writing, in emails and all of that, but not at Cure. We encourage people to come out of that mindset. So similarly, people post messages like, taking a day off for mental health, and that's all right. We encourage that. All the top management encourages that. So that's one thing. Secondly, during the pandemic, what we have seen is that initially people liked working from home, but then that disconnect from society started affecting them mentally, especially when we are working long hours and you don't have that human touch that was being broken. So what we did, and we are still continuing today, is that every Wednesday from 5 to 6 p.m., we have invited a couple of meditation experts who come on and take deep breathing exercises for the company. And anybody who's free at that point of time is encouraged to join that. And I mean, to set an example, like most of us also joined those sessions. So basically, it's all about, I mean, being comfortable with how you are feeling at that point of time. Once that acceptance is there that yes, there is burnout, there is issues with mental health, then the next step is to take care of the solutions that can solve them, right? So those are the two things. And thirdly, like I'm recently reading this book called The First Cell by Arza Raza, and I completely, I mean, agree with what Dr. Pramesh was saying about the stress that doctors have to go through, especially when they work in diseases like cancer, right? So EQ is a lot more important for them. But even in management, I've seen that as long as you have good emotional quotient and you can connect with your employees, that conversation itself solves a lot of issues. Yeah.
Thank you. Thank you, Ankit. It's very good to hear your thoughts. And perhaps, just 1 hour is not enough to hear all these things. We need at least a day or so, ideally speaking. But we are going to write an article and we welcome any of your thoughts later on after this article. But before we finish, the most important question, perhaps, that I want to ask Dr. Shweta Jaiswal, who is the general manager for EHAC. And in fact, we wanted to invite more women onto the panel, but last moment they had to fly abroad. Obviously, women are more busy than men. But it's been proven fact that women are more at risk of burnout because obviously they are multitaskers, right? We men only have our hospital to go to and come back, but they have child care, they have parents care, they have in-laws care, and especially in India where we have too many relatives around us. So Shweta, and you yourself have been a cancer survivor, and we all appreciate your input to EHAC. But I just wanted your thoughts on the aspect of burnout in healthcare in women. Can you tell some experience of your own as well as any possible preventative methods that is useful for the audience?
Yeah, good evening, all. So, from my perspective, and as I've seen in my work, I'm an intensivist basically. So, women in India, I would say, I have more stress, more in particularly in pandemic, we have faced more burnout because in intensive care, the work was definitely very, very tough in India. And okay, in all the corporate hospitals, they had all the PPEs and everything, but the other setups, the PPEs and things were lacking. It was causing a lot of stress. People were falling ill, and women having the dual role of taking care of their home also and being, equally at par with men, it added to the stress. And many of my colleagues have faced burnout. They took a sabbatical from work. They have simply just said, okay, we cannot go to work anymore. So that's the reality. And the second part, which is neglected, okay, because a doctor taking a sabbatical from work, it's still okay. But what about the nurses? The nurses are the predominant workforce, and I still believe females are more there. But we don't give importance to our nurses, who are maybe more at stress than the doctors, I would say. And the organizations, wherever we work, they give importance to the doctors, but not the same importance to the burnout in nurses, which I believe is something we should seriously take into consideration. So that's my perspective.
Fantastic. Thank you so much for your thoughts. Last moment, but I really appreciate that. And I also want to thank Ms. Srishti Gupta, who has been helping out with the webinar and also with the content of it. Thank you very much. I don't see any audience questions, and it's exactly 8 o'clock. I know Dr. Ravi and Dr. Pramesh, they are all wanting to go back to their work, as well as Raj Gopal and Ankit. So thank you so much for spending the precious moments. As I said, we are going to write an article and hopefully we'll publish it in a journal. But if there are any further thoughts, please welcome to write an email, write your thoughts, or ask your colleagues to join in and contribute. And of course, the next webinar, we are expecting Dr. Ravi to go through in a more formal discussion, like a PowerPoint presentation to help thousands of doctors who are at risk of suffering from burnout. So thank you once again. And I would like to just listen to final thoughts, if any, from any of you. So please, feel
Can I
free.
just say something? I think
Yeah.
Shweta's touched upon a very good point on the nursing care. I think the doctors still have recourse to a lot of help, but the nurses much less so, especially in India. So what we did, we made a small change during COVID and just post-COVID. What we did was we introduced a buddy system for the nursing care.
Mm.
Instead of one nurse taking care of 4 patients, we put two nurses taking care of 6 patients. So that's helped in, with the nurses discussing amongst themselves, that's helped decrease their, anxiety and decrease the pressure on them. So that buddy system has helped a lot. So,
Very useful. And in fact, even the trainee stages, if you have a buddy, you will probably feel a bit more comfortable to go through the same training systems. Thank you. Thanks. Dr. Ravi,
Yeah,
any thoughts?
that's exactly recommended by the Veterans as Administration as well, to prevent suicide in the veteran and treat PTSD. And physicians are almost like a warriors these days. We're in the war every day, so we have to have the same mindset of buddy system to go back to. And my plea to technology people here, like you said, it's a tool. I'm a very technophile guy, but I think besides the exhaustion of the kind of immersion in the technology, I think we have another big battle to fight with the social media. I think the misinformation and kind of mischaracterizations we have to deal with is the biggest problem that we're going to face unless there is some limits and some increased responsibility by the social media. We're going to have a lot of problem, because the problem is we are driven by data, information, and knowledge. These are not enough. Data sciences, information technology, knowledge economies are not going to solve the problem. The wisdom-based societies. Wisdom is what gives you the extra judgment to do the right thing with the knowledge and technology. Unless we promote wisdom-based culture and society and instructions, we're not going to succeed. So the take-home point, we have to be wise, not just be smart.
Thank you. Thank you so much. Dr. Pramesh, any final thoughts, please?
No, I'll agree with what most of the others said, but I'm probably shooting myself in the foot here. But I think administrators need to take a lot more responsibility for the well-being of their employees. We can't get beyond this. I can't imagine a world where life goes on as usual with administrators administering, which is making sure patients are treated well without caring for what their employees are going through. I think that stage is far gone, and we need to go much beyond that. We need to take responsibility as administrators to ensure that, as importantly as we prioritize the care that our patients get, we also need to prioritize the well-being of our employees. And to me, that's the single most important change in mindset that we need to go through to ensure that things like anxiety, depression, burnout don't happen in us. Because it's in our own interest. It's not just for the sake of the employees. If you have a happy employee, they work well, and your overall outcome is better. So from whatever perspective you look at it, we as administrators have to take the responsibility to ensure that our employees are happy.
And final thoughts from Ankit. Ankit, any thoughts? Can AI help us prevent burnout in the future? That's a burning question many people have.
Sure. I mean, from me, the answer is yes. But I think a lot of mindset has to be towards empathy-led technology. The technology companies have also to follow the modus operandi of healthcare, which is first do no harm. Do no harm to doctors and do no harm to patients. Let them, take work out from their plate and then allow them to spend more time with patients. So empathy-led technology is what I think can solve for future.
Very
can
well
I
said.
just add one small point? I completely
Sure.
agree with Dr. Pramesh. I think just like you have so many committees in the hospital, I think administrators should take the lead and start making something, say something like a coping committee or something like that. You have like committees for every small thing, from infection control to everything. So why not have committees that actually see whether the
Actually, in API
are
this year,
suffering?
I'm going to do a physician wellness committee, and that's what my goal is to do.
Yeah, I think that could help, prevent rather than treat.
I know
Yes.
some organizations have well-being committees, well-being committees for their healthcare workforce. So,
I'm
yeah,
not
it's
talking
something
about,
which I
like
think
committees that organize, happiness events and stuff like that. Seriously look for, the problems that we face, basically the Maslach index in their own employees, and see whether people are going through a phase where they are feeling the pressure, and then try to help them cope with it.
absolutely. And as Ankit said, empathy, not just technology, but generally speaking, trainees, trainers, and supervisors at the level of nursing care professionals, janitors, if you treat everybody with empathy, I think there is certainly an effect of calming or soothing down their nerves and reducing the stress on our workforce. So, with that, we will end. Sorry, yeah, Dr. Pramesh, yes, please.
Yeah, I think Aishwarya has a question or a comment. I saw her raise hand a couple of minutes.
Hosts, can you enable her
Can you
mic,
enable her to
please?
speak? Is there a way that we can take?
I've done that already.
Aishwarya said she wanted to add perspective from women's doctors,
Yeah.
but I
Just,
think Shweta did that. Yeah, go ahead,
uh,
Aishwarya.
yeah. Just I wanted to add one or two things. Like, apart from responsibilities from home, women doctors face other issues also. Like, there is a powerful gender-based dynamics they have to face in a different institute. Sometimes when they express distress about something, they are judged as they are emotional people. They are being oversensitive towards issues. It's very commonly faced by me. Plus, there is one more issue of sexual harassment. Sometimes it's from fellow doctors or senior doctors, or sometimes patients' relatives also. So many institutes don't have policy how to handle that kind of complaint from a female doctor, and it is many times neglected, and nobody thinks about it. So these issues also add to the burden they face. Yes, this was the point.
Absolutely, absolutely, Dr. Aishwarya, and very thankful to you to bring up this point. And in fact, we wanted to invite more women, but unfortunately, they were all traveling abroad, so we couldn't involve. But in the next, which is part two, where Dr. Ravi is going to elaborate on these aspects as well, we are going to touch upon and stress these points about women's well-being and the risk of burnout in the women healthcare workforce that we have. But thank you very much for pointing this out. Okay, I think we can end now because we're already 10 minutes into the time lapse. So thanks once again, everyone, each one of you to contribute to this webinar. And please wait for the next webinar, which is probably going to be the first week of July, whenever Dr. Ravi Kohli is free, and he'll go through much more detail. Thank you, and have a good
Thank you
night.
so much, Venkat. Thank you so much, EHAC,
Thank
for organizing it.
Thank you,
Thank
Venkat, for
Thank
giving me
you
this
more.
opportunity to interact with so many of you. Yeah, my term starts on June 25th, and I'll be more than glad to work with all of you during my year. And we'll be doing a Global Health Summit in Visakhapatnam in January, first week of January. So please look forward to the invitation, save the date, and come over. Thank you.
Absolutely.
Thank
Thank
you
you.
so much. Thank you.
Thank you, Dr. Pramesh. Thank you, Ankit.
Thank you.
And
Thanks,
thank you,
everyone.
Shweta and Shrishti.
Thank you.
Thank you.
Thank you.
Bye.
Bye.
You can stop the recording now.
Yes, I'm doing that.